Most Wegovy reviews make one major mistake. They show you a dramatic before and after photo, but they leave out what happens between the first injection and month 6. They rarely show you the nausea after a dose increase, the weeks when the scale barely moves, or the hunger that can return if the medication is stopped. So today, we are reviewing the full 6-month Wegovy journey, the early results, the side effects, the plateau, and the part many people are not prepared for. Before we begin, an important clarification. This is not a personal weight loss vlog, and it is not a promise that your experience will look exactly like this. The title uses the familiar language of a 6-month review, but this analysis is based on clinical trial findings, prescribing information, and the patterns healthcare professionals commonly monitor during treatment. We are going to follow a typical Wegovy timeline from the starting dose through the maintenance phase. Wegovy contains semaglutide, a GLP-1 receptor agonist. It affects appetite regulation, fullness, and gastric emptying. But it does not produce the same response in every patient. In the Step 1 clinical trial, adults receiving semaglutide, 2.4 milligrams alongside lifestyle intervention, lost an average of approximately 15% of their starting body weight over 68 weeks. That is a meaningful average, but it is not a 6-month guarantee. Some people lose considerably more, some lose much less, and some discontinue treatment because of side effects, cost, access, or personal preference. This video is educational and should not replace advice from your prescribing clinician. Never change your dose or stop treatment without discussing it with the healthcare professional managing your care. During the first 2 months, the most noticeable change may not be the number on the scale. It may be the sudden quieting of appetite. Many patients describe feeling full after smaller portions, thinking about food less often, or losing interest in foods that previously felt difficult to resist. This can begin early, even while the patient is still taking one of the introductory doses. But there is an important detail that online reviews often miss. The starting doses are primarily designed to help the body adjust. They are not necessarily expected to produce the medication's full weight loss effect. Wegovy injection is traditionally increased gradually, rather than beginning immediately at the full maintenance dose. That slow escalation is intended to reduce gastrointestinal side effects. During these first 8 weeks, weight loss can be encouraging, but it can also be inconsistent. A person may lose several pounds rapidly because they are eating less, retaining less fluid, or consuming fewer high-sodium foods. Another person may see only a small change, despite noticing clear appetite suppression. Neither response predicts the entire journey. The first 2 months are also when patients begin learning how their body responds to delayed gastric emptying and reduced appetite. The most commonly reported side effects include nausea, diarrhea, vomiting, constipation, and abdominal discomfort. Some people also experience reflux, burping, fatigue, headache, or dizziness. These symptoms are not proof that the medication is working better. In pooled step trial data, weight loss was largely independent of whether a participant experienced gastrointestinal side effects. In other words, you do not need to feel sick for Wegovy to be effective. Mild nausea that comes and goes is very different from repeated vomiting, an inability to drink fluids, or severe abdominal pain. Those more serious symptoms should not be dismissed as something you simply have to endure. From a nursing perspective, one of the biggest early risks is not simply nausea. It is the chain reaction nausea can create. A patient feels sick, so they stop drinking. Then they become dehydrated, constipated, weak, and dizzy. They may try to eat one large meal when they finally feel better, only to trigger more discomfort. That is why symptom tracking matters. Record when the symptom begins, how severe it feels, whether it follows the injection or a dose increase, what you ate, and whether you are able to keep fluids down. A clear pattern gives your clinician far more useful information than simply saying, "Wegovy makes me sick." By months 3 and 4, the journey often becomes more complicated. The medication dose may be increasing, appetite suppression may become stronger, and the initial rapid drop on the scale may begin to slow. This does not automatically mean Wegovy has stopped working. Early weight loss is rarely linear. The body is constantly responding to changes in calorie intake, activity, hydration, glycogen storage, hormones, and body mass. As body weight decreases, the body requires fewer calories to maintain itself. That means the same eating pattern that produced faster loss at the beginning may eventually create a smaller calorie deficit. The scale may stay unchanged for a week, or even several weeks, while waist circumference, appetite, or clothing fit continues to change. Months 3 and 4 may also include some of the more noticeable dose escalation effects. Clinical analyses of the STEP program found that gastrointestinal symptoms occurred most frequently during or shortly after dose increases. A person who felt comfortable on one dose may experience renewed nausea, constipation, or fatigue after moving to the next level. That does not mean every increase will cause side effects. It also does not mean patients should force themselves through severe symptoms simply because the calendar says it is time to increase. Dose decisions belong between the patient and the prescriber. Depending on the patient's response and the official dosing instructions, a clinician may decide that escalation needs to be delayed or otherwise adjusted. The goal is not to reach the highest dose as quickly as possible. The goal is to find a treatment plan that is effective, safe, and tolerable enough to maintain. This is also the stage when eating less can become both an advantage and a problem. Reduced appetite can support weight loss, but extreme restriction can make it difficult to consume enough protein, fluids, fiber, and micronutrients. Some patients unintentionally replace balanced meals with a few bites of whatever feels easiest to tolerate. Over time, that can contribute to weakness, constipation, poor exercise recovery, and loss of lean tissue. The medication can help control appetite, but it does not automatically build a nutritionally complete eating pattern. A clinically stronger plan usually includes adequate protein, resistance exercise when appropriate, hydration, and enough total nutrition to support daily functioning. This is not about eating as little as humanly possible. It is about creating a sustainable pattern that protects health while weight is changing. By months 5 and 6, many patients expect the scale to keep moving at the same speed it did in the beginning. When that does not happen, the first reaction is often panic. Has my body become immune to Wegovy? Usually, that is not the best explanation. Weight loss curves from semaglutide trials show that progress tends to slow over time rather than continue at the same rapid rate indefinitely. A true long-term plateau usually develops later than 6 months for many patients, but temporary stalls can happen at any point. The body becomes smaller. Energy needs change. Appetite may become more noticeable than it was during the first few weeks. Daily habits may also begin drifting back toward old patterns, and sometimes the apparent plateau is simply normal scale fluctuation. The human body is designed to resist weight loss. As weight decreases, hunger signals may rise, energy expenditure can decline, and the calorie deficit may become smaller. This is called metabolic adaptation. It does not mean the metabolism has been destroyed. It means the body is adjusting to a lower weight and lower energy intake. Wegovy may reduce some of the biological pressure to eat, but it does not eliminate every adaptive response. This is where sleep, protein intake, resistance training, meal structure, and realistic expectations become increasingly important. It is also where patients should avoid chasing rapid results by eating dangerously little or changing the medication without clinical guidance. Six months can show whether a patient is tolerating the medication and beginning to respond, but it may not show the final result. Step 1. Measured outcomes over 68 weeks, not merely 6 months. Participants continued losing weight beyond the early treatment phase before the average curve gradually approached a plateau. This is why comparing your 6-month result with someone else's 16-month transformation can be deeply misleading. The more useful questions are: is there a meaningful downward trend? Has appetite control improved? Are health markers changing? Can the patient follow the treatment safely? And is the plan sustainable enough to continue? Let us put the side effects on a realistic timeline. Nausea, vomiting, and diarrhea tend to be most noticeable during dose escalation or shortly after a higher dose is introduced. In pooled Step 1 through Step 3 data, nausea was reported by approximately 44% of semaglutide participants, diarrhea by about 30%, vomiting by roughly 25%, and constipation by approximately 24%. These numbers include any reported episode during the trials. They do not mean every patient experienced these symptoms continuously. Most gastrointestinal events were mild to moderate and temporary. Individual episodes of nausea, vomiting, or diarrhea often lasted days rather than months. Constipation could last longer and may require earlier attention to fluids, movement, fiber, and clinician-approved treatment. Some patients experience few or no side effects. Others find the medication difficult to tolerate. And a small but meaningful group discontinues because the symptoms interfere too much with daily life. During month 1, nausea, fullness, reflux, and changing bowel habits may appear as the body adjusts. During month 2, some early symptoms may settle, but a dose increase can cause them to return. During months 3 and 4, symptoms may flare around additional escalation steps. During months 5 and 6, patients who are stable on a tolerated dose may notice fewer gastrointestinal symptoms. But persistent constipation, reflux, or reduced food intake should still be addressed rather than normalized. Fatigue may occur early if calorie or fluid intake falls too quickly. It may also signal another problem that deserves evaluation. Symptoms that suddenly appear after months of stability should not automatically be blamed on Wegovy without considering other possible causes. Some symptoms require more than a tracking sheet. Contact a healthcare professional promptly for persistent vomiting, inability to keep fluids down, symptoms of dehydration, severe or persistent abdominal pain, significant abdominal swelling, severe constipation, or symptoms of an allergic reaction. Severe abdominal pain, especially if it travels toward the back, requires medical assessment. Possible gallbladder symptoms, such as upper abdominal pain, fever, or yellowing of the skin or eyes, also deserve prompt attention. Wegovy's prescribing information contains additional warnings, contraindications, and precautions. This medication is not appropriate for everyone. Do not use social media comments as a substitute for medical evaluation when a symptom is severe, persistent, or rapidly worsening. Who is most likely to respond well to Wegovy? There is no single body type that guarantees success. The major STEP trials generally enrolled adults with obesity or adults with overweight, plus at least one weight-related health condition. In clinical practice, candidacy should be based on approved indications, medical history, risk factors, and an individualized discussion, not simply on wanting to lose a few cosmetic pounds quickly. Step 1. Subgroup analyses found meaningful average weight reduction across different starting weight categories. That tells us higher starting weight is not the only factor determining whether someone responds. Response may be influenced by multiple factors, including insulin resistance, diabetes status, appetite biology, sleep, medication use, hormonal conditions, and individual genetics. For example, semaglutide trials involving people with type 2 diabetes generally showed less average weight reduction than trials involving participants without diabetes. That does not mean the medication is ineffective for people with diabetes. It means average outcomes can differ between populations. Two patients can take the same dose, follow similar routines, and still experience different results. That variability is biology, not a moral failure. People often say Wegovy works best in patients with good lifestyle compliance. But that phrase can sound as though every difficult outcome is the patient's fault. A better term is lifestyle support. In clinical trials, semaglutide was studied alongside lifestyle intervention, not in isolation. Patients generally do better when they have access to appropriate nutrition, movement they can safely perform, adequate sleep, medication follow-up, and help managing side effects. The medication can reduce appetite. It cannot shop for groceries, build muscle, correct sleep deprivation, or create a long-term maintenance plan. The strongest responders are not necessarily the most disciplined people. They are often the patients whose medication, biology, daily habits, and support system work together. Now we need to discuss the part that many transformation videos avoid. What happens when Wegovy is stopped? In the Step 1 extension, participants were followed for 1 year after semaglutide, and structured lifestyle intervention ended. During that year, participants regained approximately 2/3 of the weight they had previously lost. Many of the cardiometabolic improvements also began moving back toward baseline. This does not mean every patient regains the same amount. It does mean weight regain is a predictable biological risk, not proof that someone lacked willpower. Step 4 gives us another important comparison. Participants first received semaglutide for 20 weeks. Those who reached the maintenance dose were then assigned either to continue semaglutide or switch to placebo while lifestyle intervention continued. The group that continued semaglutide lost additional weight. The group switched to placebo regained weight. The key lesson is not that every person must remain on Wegovy forever. The lesson is that removing an appetite-regulating treatment can allow the biological drivers of weight regain to return. A stopping plan should therefore be discussed before the medication is discontinued, not after hunger and weight have already rebounded. Wegovy does not permanently erase the body's appetite regulation system. While taking the medication, many people experience less hunger, earlier fullness, and reduced food noise. After stopping, those effects can diminish. Hunger may feel stronger, portions may gradually increase. Foods that seemed easy to resist may become more compelling again. That experience can be emotionally difficult, because patients sometimes believe the medication taught them to control hunger permanently. But hunger is not merely a habit, it is a biological signal. A realistic maintenance plan may involve continued medication when appropriate, a different treatment strategy, structured nutrition support, resistance training, regular monitoring, or a combination of approaches determined with a clinician. So, after reviewing the first 6 months, what is the honest clinical verdict? Wegovy is not a miracle, but it is also not simply an easy shortcut. For appropriate patients, it can produce clinically meaningful weight reduction, improve several cardiometabolic risk factors, and make appetite feel more manageable. Its effectiveness is supported by large randomized trials. But the medication has real limitations. Side effects can interfere with quality of life. Some patients do not respond as strongly as expected. Access and cost can disrupt treatment. Lean tissue can be lost along with body fat. And weight regain after discontinuation is common. It should not be sold as effortless, risk-free, or permanent. At the same time, patients should not be shamed for using a medication to treat a chronic health condition. The most balanced conclusion is this: Wegovy can be a powerful treatment tool when it is prescribed appropriately, monitored carefully, and combined with a realistic long-term plan. It is a tool, not a test of character, and not a complete treatment plan by itself. If you are currently taking Wegovy or preparing to start, do not rely on memory when side effects appear. Tracking your injection date, dose, food intake, hydration, and symptoms can help you recognize patterns and explain them clearly to your healthcare professional. I created a simple GLP-1 side effect tracker to help you organize that information. You can find it through the link in the description. For more balanced, nurse-led GLP-1 education, subscribe to the GLP-1 Nurse. And in the comments, tell me where you are in your journey. Just starting, approaching maintenance, or considering stopping. Please avoid sharing personal identifying information, and remember that the comment section cannot replace medical care. Your Wegovy journey may not look like the clinical trial average. It may not look like the transformation you saw online. You may lose quickly, slowly, or unevenly. You may tolerate every dose or discover that this medication is not right for your body. None of those outcomes defines your worth or your effort. The best treatment is not the one receiving the most attention online. It is the one that supports your health, fits your medical needs, and can be managed safely over time. Give your body patience, give yourself honest expectations, and keep your healthcare team informed along the way. I'm the GLP-1 Nurse. Thank you for watching, and I'll see you in the next video.